Hello, my name is Kyungtae Bae from South Korea, and it is very honored to be here, and thank you for participating this session. And today I'm going to talk about the PCL, the Gouri, treatment techniques by depth of injection and clinical outcomes. So this is short CV of mine. Let's move on. So first of all, I want to talk about the aging process and collagen. Collagen is the most abundant protein in our body. It is crucial protein that supports and forms the structure of the skin, but it gradually decreases with age. Along with collagen, elastin, HA also decline over time, causing the skin to weaken, become dry, and lose its elasticity. Skin aging is influenced by various factors, and as a result, the once complex structure of the dermis gradually becomes simpler. That's why we perform various anti-aging treatments tailored to each situation. So the goal is to restore something like this small, wrinkled apple back to its beautiful shape. Today, I'm going to talk about the treatment specially focused on skin tightening. To achieve skin tightening, it's essential to stimulate the production of collagen and elastin, and the fibroblast in the dermis plays a crucial role in this process. Fibroblasts, the most abundant cell in the dermis, are unique and highly capable. Usually, they are in a resting state under normal condition, but they become active when stimulated, producing collagen and elastin directly. And they also play diverse roles, such as wound healing and regulating inflammatory responses. So when needed, fibroblasts can even differentiate into other cell types. In conclusion, to achieve the desired skin tightening, we must effectively stimulate fibroblasts. So there are two main ways to stimulate fibroblasts, hot and cold. Today, I'll focus on one of them, biostimulators using polymers. There are various types of polymers, and this table summarizes their general characteristics, PDO, PLA, and PCL. Each polymer differs in terms of melting point, longevity, and degree of hydrophilicity. Among them, PCL, which we will focus on today, has a long-lasting effect and is a powerful collagen stimulator, but its low hydrophilicity has made it difficult to use. This is because of the most frequent mentioned issue with polymers, nodules, and granulomas. PCL, being hydrophobic, tends to clump together in the body, which can lead to such problems. Therefore, proper hydration, dilution, and careful injection techniques are necessary. Despite these precautions, complications can still occur, making hard to approach. So PCL is the most recently developed polymer, offering a longer duration and superior collagen synthesis ability compared to other polymers. It is also safe, non-toxic, and highly biocompatible. PCL breaks down into CO2 and H2O, which are naturally excreted from the body. However, PCL has not been widely used due to its large particle size and extreme hydrophobicity, which prevent it from spreading when it is into the body and lead to various issues like nodules or granulomas. If a PCL formulation with smaller particle size and higher hydrophilicity were available, these problems could be effectively resolved. So the product that meets this condition is Gouri. Developed by Dextravel, Gouri retains the advantage of PCL while overcoming its limitation. So by utilizing microparticles, they have created a liquefied PCL formulation. So Gouri has three key features. First, spreadability. Its high hydrophilicity allows it to spread widely. Second, sustainability. Due to the characteristic of PCL, it offers a long-lasting effect. Third, safety. Due to its small particle size and hydrophilicity, it does not cause vascular compression or particle aggregation, meaning that it has very low risk of necrosis, nodules, or granulomas. Many doctors have questions about Gouri's spreadability. To address this, I'd like to share clinical results from an experiment conducted by Dr. Joy. Honestly, I was also quite surprised by this finding. In this study, 1 cc of Gouri was injected as a bolus using a needle on the forehead. There was no massage, no molding after the injection. After 6 hours, it was observed that the product has spread significantly compared to its initial states. After 1 day, the product appeared much more natural, and by around 3 days, there were no visible signs of the injection. So the purpose of the anti-aging treatment I want to perform is this. The purpose is that to make healthy thermal condition, and how the collagen synthesis with polymer injection, especially liquid PCL, the YPCL, the most powerful polymer material of the synthesis. It's the latest invention of the polymer. And why liquid PCL? It is fast, effective, and no side effects of the conventional polymers like nodules. And where do we put them? Then dermal layer or subdermal layer with cannula or with needle-free jet injector. So our face is composed of multiple layers. For deep fat under the muscle, HE fillers are ideal for adding volume. For the subcutaneous layer, contains fiber structures called retinacula cutis, and Gouri helps to strengthen these. For the dermis, Gouri can be directly injected using needle-free jet injector. By addressing each layer with a specific purpose, we can utilize a layer-by-layer technique for optimal results. So I want to share the protocol. This is the preparation of the Gouri. And this is the conventional way. When I use this method, I use at least 3 cc's of syringe and into the subdermal layer with 25 or 23 gauge cannula. And the first entry point is the lateral, the 3.5 centimeters from the lateral canthus at 25 degrees. And the second point is above the eyebrow. And you just have to linear technique, retrograde linear technique to inject them. And the other one is the cannula injection for lateral area for lifting. The first point is in front of the sideburns on the zygomatic arch, and we spread it into the temporal area to lift it. And the second point is that Second point is the mandible angle, and first injection points are the mastoid area and the loris fascia to strengthen these lifting fixation points when we use the thread insertion. So these are the use of cannula injections, and the outcomes will be discussed by the excellent speakers who follow. But as for me, I would like to introduce the method of injecting Gouri into the dermis. So there is several ways to inject Gouri into the dermis, but what I think is the most effective approach is using a needle-free jet injector. I use a Imcas-based needle-free jet injector, and here's a brief explanation of how it works. Imcas laser have a high water absorption coefficient. So when the laser interacts with the water, it creates a sudden explosion. Inside the handpiece, there are 2 chambers separated by diaphragm, one for the water and one for the drug. When the laser targets the water chamber, the explosion generates a pressure that pushes the diaphragm and transferring the pressure to the drug chamber. So this causes the drug to be expelled through the nozzle at very high speed. The advantage of using this device is not only effective drug delivery, but also added benefits of mechanical stimulation. So that's why I prefer large mixing volume of Gouri and to maximize both drug delivery and mechanical stimulation. So I mix total 12 cc of solution, and this method will bring up to 40,000 shots. So I call this technique the Gouri shower, as it involves spraying Gouri across all over the face like laser toning. The major benefit of this method is that it allows for treatment of the areas that were previously challenging to approach with cannula or polymer-based injection with cannulas. So this includes like eyelid or the areas just under the eye and the side of the nose bridge and the pores around the nasal ala or tip and also the area directly above the lip. So this technique ensures the thermal injection, and the purpose may differ slightly from using a cannula because cannula injections are targeting the subdermal layer. So when injected into gelatin, it was observed that the consistent amount of the drug penetrate to uniform depth. And this image shows an ultrasound scan taken after the NFJI procedure, confirming that the drug has successfully penetrated into the dermal layer. The image below the historical photograph, and it also demonstrates that the drug has penetrated into the desired dermal layer. And also this image further suggests that the drug not only penetrate, but also it includes the microsubcision effect with the tissue. So this is a video showing jet formation based on difference dilution ratio. Although the distinction may not be clear in the image, in the video, but the white color makes the concentration difference visibly apparent on bare eyes. So I wanted to show that even with the high concentration dilution of 1:1, there is no clogging of the nodule. So meaning that Gouri is a liquid form and the small particle size ensure there are no clogging issue. So since the jet injector is needle-free, there is some drug loss during the procedure. However, the numerous microchannels created during the treatment allow for additional absorption through simple rubbing after the procedure. To further enhance absorption efficiency, plasma device or penetration ultrasound device can be utilized. So you can see the medial canthus, we could approach there, and right under the eye, we can approach there, and also eyelid, and nasal ala, and the nasal tip, and also right above the lips. And see the half of the right side is already proceed, and you can see the redness, and this is the endpoint of the NFJI. So let's take a look at the before and after photo. This patient underwent Gouri treatment to improve over wrinkles. These before and after photos were taken 1 month after completing 3 sessions. You can clearly see the improvement in fine lines on the forehead and glabella. And the improvement in wrinkles around the eyes is also noticeable, especially crow's feet and wrinkle on the side of the nasal bridge near the eye. You can see that right here. And you can see that the skin appears like little more tighter and more rejuvenated. The opposite side also shows excellent results, looking at the crow's feet and the wrinkles on the side of the nasal bridge near the eye. The wrinkle around the mouth have also improved. And the improvement in fine lines above the lips and around the meridian lines can be observed clearly. And this patient also shows results 1 month after 3 sessions with noticeable improvement in fine lines under the eyes and pore appearance. The improvement in pore appearance on the glabella was also evident. And if you look at the area around the eye and under the eye has tightened and leading to an improvement in fine lines. The opposite side also showed the results. And this is the photo I wanted to highlight in the most on these patients. When actually she underwent rhinoplasty and treating pores in patients with a surgical history on the nose can be very challenging. However, the Gouri treatments, there was a significant improvement which was meaningful outcomes. The pore size on the opposite side of the nose has visibly decreased. And although further follow-up is needed, I anticipate even better results over time due to a long-lasting effect of Gouri. Noticeable tightening effect was observed around the nasolabial folds and the surrounding mouth. When using Gouri with NFJI, the results are more focused on improving skin texture and fine lines rather than providing a lifting effect. So the indications are a little bit different. So like this. And this is my photo. The same treatment method was used. And this is the result 1 month after 3 sessions. The most noticeable improvement in my photo is the wrinkle under the eyes. And this area is particularly sensitive and challenging to treat effectively with fillers. And the sharp and deep wrinkle have visibly improved, showing excellent results. This is the other side. And I want to show this picture, this photo after photo. What surprised me the most is about receiving Gouri is the treatment was how quickly the effects become visible. Even with just 1 session, in the 1 month follow-up photos already showed excellent results. So if you look closely, observe the results under the eye, they are quite dramatic. And who would believe this is just 1 month after a single session? Honestly, the results were shocking even to me. So moreover, the tightening under the eye area has been well maintained until now. So in conclusion, if you step outside the exhibition booth, you'll see many companies promoting natural collagen stimulating products, collagen boosters, especially polymers. So they're global trend, and we are now living in the era of polymers. So among the various polymers, the most powerful is PCL, the particularly liquid PCL that use microparticles to overcome the limitation of traditional formulations. So Gouri stands out with 3 key features: spreadability, sustainability, and safety. So as a liquid PCL, Gouri allows for a variety of treatment methods, enabling its use in multiple indications. So today, I mainly introduce treatments with NFJI, but following this session, other excellent speakers will discuss technique using other methods like cannula. So in my experience, Gouri is simple, fast, and powerful. This is distinctly different from any other polymer that we've been seeing so far. And I believe I'll performing many treatments with Gouri like this year. So just, you have to try it once and you'll know the difference. Thank you.
Thank you, Doctor, for the great presentation. I would like to invite our next speaker, Dr. Paul Han from Australia. I guess a lot of you here already know Dr. Han. And today he will be sharing a lot of information on Gouri combinations. So please, welcome.
Good morning, everyone. Welcome. My name is Dr. Paul Han. I'm from Australia. Now, I've been a strong advocate of this Gouri, world first liquid polycaprolactone, which is, I believe, is the future of high polymer materials, with the highest safety level without nodule formation so far. I haven't experienced. Now, I'm not here to talk about Gouri. I will be talking about Gouri, but I'm here to talk about something else. I've been waiting for this new product called DXP. Now, Gouri is very good. As Dr. Bay mentioned, it's really good for skin rejuvenation and skin tightening by producing massive amount of collagen without too much volumization. But in my clinic, I had a little bit of limitation in contouring my clients. So I've been waiting for this product, which actually needs a bit of filling, contouring result, and plus the massive tightening result at the same time. And this DXP is the one I've been waiting for. So I've been experimenting on this. We had a study group for 2.5 years. I'll be sharing some information. And by combining this non-volumizing Gouri with the volumizing and tightening DXP, you can achieve so much more in your clinic with your clients. So DXP is basically a liquid Gouri in higher concentration within CMC gel. So what happens? Those of you who's not familiar with Gouri, I'll explain. So in the past, we have HA fillers. HA fillers work in one-step process, maybe 1.5, because they attract water after injecting HA materials. So it works, it's high viscosity, and so it has some vascular obstructive side effects you need to avoid. It's low durability, it doesn't last long. And the safety profile is just an average because vascular obstruction can happen. Now, conventional existing collagen-stimulating fillers, they work in two-step process because they have a microsphere. So the microspheres are trapped in CMC gel. So once you inject 1 ml of that existing product, you have to wait 3 to 4 weeks for a CMC gel to disappear before the PCL microsphere can start acting. So what you notice with existing product is that you actually get a dip in the volume, and then it gets slowly replaced, but never get replaced fast enough to fill up that 1 ml that we injected initially. But this DXP is different. It comes in 0.25 ml syringe, and over the next 2 to 3 months, it develops massive amount of collagen, and it builds up within the CMC gel. Once we inject that 0.25 mils of product, it starts acting straight away because it's not microsphere, it's liquid. So instead of waiting for 3 to 4 weeks, neocollagenesis effect kicks in from week 1 straight away. So that's why there's no dip in the volume. And from 0.25 of this biodegradable, biocompatible material stimulates enough collagen to give 1 to 1.2 mils of volume with your own collagen over the next 2 to 3 months. And the result lasts for quite a long time, 2 to 3 years. So you can also make use of this. I actually make use of this in some urology clients with my, I can actually create an embossing if you inject this in the right layer and create an embossing in a penile, your male clients as well. And it will stay that bolus for 2 to 3 years without spreading. So this is just to compare with the competitor. As I explained earlier, you actually get a dip in the volume with the existing microsphere form of the polycaprolectone. Whereas the DXP, which is a liquid preparation, neocollagenesis start from as soon as we inject. That's why there's no decrease in volume, and we get increase in volume up to 1 to 1.2 mil over the next 2 to 3 months. So this actually shows nicely the volume keeps increasing up to 2 to 3 months, and then the competitors, they keep decreasing. Now, when we're using DXP, we have to make use of the fact that this is actually PCL's strongest collagen stimulator. So we're not just looking for the volumizing effect. We're also looking for the tightening and lifting effect with this one. So this one, when I first used it, I didn't have this quantifier to measure the volume. But what I told the company, as soon as you inject 0.25 mil, I feel I'm getting around 0.5 mil worth of volume. And slowly over 2 to 3 months' time, I'm getting 1 to 1.2 mils of volume. So this product has to be done by an experienced injector and can't be done in one session. So I normally do 2/3 of my result during the first session. After 2 to 3 months, I do a little touch-up to make it perfect. So this one actually shows forehead as well. So we only injected a small amount, and over the next 2 to 3 months, you get actually 4 times volume. but it's not a HA volume. It's not a spongy. It doesn't feel like spongy. It feels like your own tissue. It feels firm. And you also get tightening with that volume you added. So 0.25 equals 1 now. As we know, less is more. It doesn't apply in HA, it applies here. So that 0.25 of high potent liquid PCL will disappear over the next 12 to 16 months and then get replaced by that 1 to 1.2 mil of collagen, your own collagen, shaped in that CMC gel shape that as it disappears. So now I wanted to, the reason why I've been waiting for this volumizing liquid polycaprolactone is because this is a result of Gouri. Just 2 mils, one line going up the temple, one line going down the nostril, one going down just to the mandibular angle. So as you can see, even non-volumizing Gouri gives a strong lower face contouring result like that. If you see that, that's before. The middle one is 1 month after and 3 months after. So by including this temple, one temple line creates that lifting result over the next 2 to 3 months. So I'm creating inverse triangle. So all of my clients who's been doing Gouri gets inverse triangle to inverted triangle, which is ideal for a younger looking contoured face. But there's a limitation. So for the people, Asian people especially, have a very volume deficient temple and volume deficient just under the zygoma area. So we needed a product which could address that issue, and DXP is the one. Now, this I added this one because not only we saw a significant lifting result looking at the front picture, if you look at under eye, that's even more significant. The Gouri, one single line, didn't even go close to the under eye. The line went to the nasolabial fold, and the spread is enough to create that volumizing, slightly volumizing effect with the Gouri. So I can even achieve that with a single line, not just directly below the under eye, well above, well away from it. I can still achieve that. So when you're using Gouri, you have to make use of that spreadability. It's liquid, so we don't have to do many lines like existing microsphere form high polymer materials, which can cause fibrosis and scarring for your clients in the future. So minimal 3 lines to achieve a full face neocollagesis effect. That's why I fell in love with this one. But as I said, so this is same. Just with the Gouri, one single line going up the temple, one nostril, and one going down, I can achieve this significant facial shape changing result. Now, I wanted to do better. So 2.5 years ago, we had a study group in Vietnam. This is before picture. I did something, and 3 months later, when we took the picture, it's a surgical result. Now, but I only used 2 products, Gouri and DXP. I'll show you how I achieved this. Sorry, I didn't actually put a nice diagram to it, but this is the real note that I did during the procedure. So I did 3 lines of Gouri mid-face to get a full neocollagesis effect for the lower face. And then replaced, followed by the DXP on the temple area, so mainly lateral lifting areas. A nose, 1 box in the nose and 1 box in the chin. And that's the result after 3 months. It's a very significant result, almost like a surgical result. So the reason why you get this, you get volumizing plus tightening. It's happening at the same time. So although we're adding volume, your face will look smaller, not wider like HA fillers if you add too much around the lateral lifting areas. So if you look at the nose is also, with the existing high polymer material, you have a limitation. With this one, I don't have limitation, and I can do very safe contouring for your nose without that avatar-looking nose. And what I also found is existing HA filler clients over the nose, where they have either Tyndall or like a cushion effect, avatar nose, I don't actually dissolve the HA filler with Hyalase before this. I actually leave HA and do DXP. What I find is actually holds those fluids in. So I found that tyndall effects disappear under eye and even the dorsum of the nose. So that's the protocol. So since I experienced that client, I started doing with my clients in Australia. So you have to make use of the non-volumizing neocollagenesis effect of the Gouri and volumizing and tightening effect of the DXP. If you use that, you can do so much more with it. Now, this lady, I've done 1 or 2 boxes of DXP over the temple.
5 minutes left, doctor.
Oh.
5 minutes
Already, okay. Okay, so this is the result after doing combination of the same protocols. There's Gouri and DXP over the temple, chin, and nose. That's the result after 2 months. Significant lifting and jawline angles are quite different. But this is a Visia. I was shocked to see in a Visia machine, it's hard to see the facial shape change. But you can clearly see the facial shape change, and this is all I did. So DXP over that blue lines and Gouri over that pink lines. Sorry, I have to hurry because I've got so many things to do. So same. So I follow the same protocol. 1 box of DSP over the nose, 1 box on the chin, and over the temple, I can create this firm-looking, tight-looking face with the oval shape. So this is an Asian protocol. Western protocol is different. So I'll go through the Western protocol. So I achieved that within 2 months, and this will result with last 2 to 3 months without having to look fatter in the past. Now, this is a Caucasian client. So Caucasian client is different. Asian clients, I do a sharp chin and I try to make an oval shape. And then I fill in the area where I'm missing. Whereas Western client, we need to define more of the zygoma and the jawline. So we don't actually feel, it's actually completely different. So what I did with this lady, same. I did Gouri and DXP just slightly on a different line. Just keep in mind, it's a liquid, so we don't have to do many cannulation like existing products. So if you look at the zygoma area, you get the increase in volume over next, so 0.25 mil of the volume increased to 1 to 1.2, and then followed by the massive tightening of the Gouri, polycaprolactone. So you get the volumizing and tightening happening. So that's why even if we added volume, our face looks smaller with this product. So if you look from the front, very noticeable as well. So various treatments. I just want to show you another protocol that I've been doing in Australia. Because Gouri lacks an initial lifting result, I actually combined with the reverse vector ponytail thread lifting. So I do 4 points and making use of the existing entry point straight after the ponytail lifting, reverse vector. I also just inject Gouri over the first entry point and the last entry point. And this is mainly to accentuate the lifting and tightening effect without feeling too heavy in the middle. So this creates a nice contoured results for my clients. Initial high lifting result by the lifting cogs, and then followed by the strong polycaprolactone result of the Gouri. Now, just for those of you who interested, so through the last entry point, I'm doing periauricular, 1 going down to the, so that's gonna massively, all you need is just single line. You don't have to do many lines with Gouri because they will spread. Okay, so in terms of lateral contouring, in my clinic, I've been using HA fillers in the past, but there's also pros and cons with each one of them. HA fillers, although it's a good instant result, volumization, it doesn't last long and you have to risk vascular obstruction and mild tightening result. Thread lifting, you get a good lifting initial result, but not so much tightening result in the later and the longevity issue, and also it's very operator dependent. Now, this DXP, it covers all of that above. I think we're running out of time, so to the conclusion, combining this liquid PCL Gouri, which is non-volumizing, and by mixing with the volumizing DXP, we can achieve so much more without having to worry about overfill syndrome with the HA or cushion face of repeated HA usage over that area. We only need minimal injection lines and achieve a full face result like that. And so PCL is fully biodegradable and disappears within 9 to 12 months. Nothing gets left behind like HA. As I said, this is really where the less is more, 0.25 is 1 now. And minimal risk of nodules. I haven't seen, last 3 years I've done 10,000 cases, more than 10,000 cases, no reported granuloma, nodules, or vascular obstructions. So, just for a bonus, Australia recently launched the Gouri. For those of you who's not familiar with cannula technique, I came up with something new. So I've been mixing 3 mils of Gouri with 3 mils of dental lidocaine epinephrine to make a 6 mil solution. So you get 60 points with it. So 20 points per side, and 5 points, 5 points, and 10 points there. That's 60 points. But make sure you use 2 mil 34 gauge or 33 gauge needle. Okay. Now, Dr. Bay explained the superficial result of it, but this will create at the 1.8 to 2 mil depth. You can create a both tightening result and very quick, consistent result over time. So that's how we do it. Okay, so I ran out of time. Thank you very much for listening. Any questions, you can ask me later. Thank you very much.
Thank you very much, Doctor. And we're moving to our last speaker today, Dr. Hyun-Suk Pyun from Japan. And even more cases will be presented by Dr. Pyun. Please, welcome.
Good morning, everyone. I'm Dr. Pyun, the director of BB Clinic in Tokyo, Japan. I'm deeply appreciated to get this opportunity to present in Honorable Imcas Paris today. I'd like to talk about how to use PCA fillers, including the liquid filler product Gouri, produced by the same company, Dex Level, to achieve full face contouring as well as lifting and rejuvenation effect. Let me introduce myself. I have double medical license in Korea and Japan, and I use more than 15,000 cc of filler every year since 2010. I used the Gouri 2 years ago. I started 2 years ago, and I do the procedure of more than 200 ml every month. As you know, the aging process, Dr. Bae mentioned about that, so I'll skip this. There are some solutions to rejuvenate the skin and fight this aging process to treat the voluminous. One of my favorite solution is filler injection. In these days, collagen stimulator is another modality for volume augmentation, such as Sculptra or Juverup to treat descent. We can use thread lifting, HIFU for deep layer sagging, and monopolar RF like Therma-Z for skin tightening and lifting, which are effective but painful. Surgical treatment is also an effective option, but it has a long downtime. Dr. Bae and Dr. Han already talked about general information about Gouri, so I'll skip this. For me, I can highlight 2 main effects of Gouri contributed to collagen formation. First one is pigmentation improvement. This case is 64-year-old woman who didn't want to inject foreign body material like HA filler, so I recommended 4 cc of Gouri. In this case, we can see the patient's skin got brightened and even toned. She had moderate degree of melasma, but it is much improved since she got this treatment. Second, of course, is a lifting effect of Gouri. This case is 67-year-old woman who has gone through surgical facial lifting, resulting in uneven skin surface along the facial contour because of the adhesion. This uneven skin is very difficult to treat because of adhesion, but can be served with Gouri. From now on, I'd like to share my experience about Gouri procedure. I use cannula technique, Arma's case, to prevent prolonged bruise, but sometimes I use 34 gauge microneedle because that is safer than cannula, for example, to restore sunken eye and around the mouth and forehead wrinkles and sometimes neck wrinkles. This picture shows entry points when I use cannula technique. First point is about 30.5 centimeter inferior from the lateral canthus point. And second point is the cross point of zygomatic arch and hairline. And third point is 1 centimeter apart from mandibular angle along the mandibular border. I usually use 25 gauge cannula, 5 centimeter length, and sometimes needle, micro needle, 34 gauge or 33 gauge, 4 millimeter length. This is my tip for doing Gouri procedure. Without anesthesia, the client can feel a burning pain in injected area. So I mix the lidocaine and saline. About 1 Gouri, I dilute with 0.5 cc of lidocaine and 0.5 cc of saline throughout this dilution technique. Gouri could be less painful than Botox and decrease the risk of bruise. Since I have used this complex, solution, bruise problem is served. Even if I made bruise when it injected Gouri with a micro cannula, it cannot prolong. And then the most common side effect is temporary edema, which usually lasts for about 2 to 3 days. In almost the case, the swelling is mild, similar to puffiness experienced after having a drink the night before. However, in 5% of cases, moderate edema may occur. To prevent edema, it is recommended to prescribe prednisolone and antihistamine for 2 to 3 days. As nodular formation is big problem in PLA solution, prolonged bruise is one of the possible important side effects of Gouri. But in my clinic, we found a way to deal with it effectively. There are various options for that, but from my clinic practice, I can say that the most effective and easy way is pico laser. This case is prolonged bruise. It's not a big deal. Here's case, a right side under eyes, prolonged bruise. It's served with pico 532 nanometer on the given parameter. It's served after this procedure. So don't worry about the bruise. And next, this is my opinion on which case can be treated and combination with Gouri and which should not be. I usually combine filler and Botox with Gouri. Sometimes I perform HIFU for deep layer lifting when I injected Gouri. For skin rejuvenation, sometimes I combine it with a skin booster. Next, let's compare Gouri to thread lifting. This case is a 64-year-old woman who had a stress, looked old. She wanted procedure without downtime because of her working. So I also treated with 4 cc of Gouri. This is not a thread lifting case. It's just a 4 cc of Gouri case. Gouri, the patient's face is not only lifted up, but also got a very nice close look. Her under eyes as well, very much improved. And then 1 year after the first Gouri session, the patient's face returned to a similar state as before the procedure. This time, I performed thread lifting. Gouri and thread lifting, both cases are much improved, but much improved the second phase. I like Gouri case better. This case is 62-year-old woman. She had complained about mid-face and low-face sagging. I recommended thread lifting first, but she didn't want invasive procedure, so I recommended 4 cc of Gouri treatment instead of that. 1 month later, the lifting effect was very good and still maintained even after 6 months. But she wanted more lifting and decided to undergo a thread lifting. A dramatic rejuvenation can be seen immediately after the thread lifting procedure. For clients who are hesitant about invasive procedure, initial improvement with Gouri treatment can be a good approach. This allows them to experience some enhancements first, making a more effective treatment in the future even more impactful. I usually combine Gouri with lifting buttocks to make shaped face line. Sometimes I inject botulinum toxin or masseter muscle to make a small face. This image shows injection points for botulinum buttocks lifting along the face line and inject buttocks into the dermal layer with 34 gauge micro needle. I like to combine control line filler when I do Gouri procedure. If you inject filler into green area, which shows volumeless with aging, you can get lifting effects and useful face. Due to time limit, I cannot show you the full treatment. First, I start with AC filler. This shows injecting the temple area. I used the hyaluronic acid filler with the 23 gauge microcannula into the subcutaneous layer. In this case, I injected 2 cc of filler each temple size and 2 cc of filler of lower cheek and 2 cc of filler or upper cheek and nasolabial fold and 2 cc for the chin augmentation. I usually inject the contour line like temple and lower cheek and chin like this. The tapping is for make it easy the inside of the filler inside of the skin, the cannula movement.
5 minutes left.
Yeah. And then I injected Gouri using different layer, more shallow layer than the filler. First entry point is 3.5 inferior from the lateral contours. I injected diluted Gouri 1 cc, and then the second point is cross points of zygomatic arch and hairline. Yeah. I usually use 3 lines for 1 cc of Gouri. This picture shows the combination treatments is used. You can see volume enhancements. Enhancing effects appears immediately. After 2 to 4 weeks, the effect of Gouri becomes visible, leading to a lifting effect and noticeable improvement on the eyes. This is doctor who came to learn Gouri treatment from me. She is now using her own face for marketing. Gouri and contour line HA filler lead to very good results for these, good results. But there is limitation that HA filler cannot last long. So if you want to last long, the effects of PCL filler is better choice. So I would like to introduce Nibelang, what is Japanese version of DXP1 Dr. Han mentioned. A product from this level, which is excellent for contour line volume enhancements. Here is a case of combination of Gouri and PCL filler in Nibelang. As with HA filler, I start with filler first, and then inject Gouri. It's about the same to the filler injection, but this filler is just 0.25 ml. So if you inject 2 syringes of this, the amount is just 0.5 cc. But right after, the effect is like twice. And then after 1 to 2 months later, 0.25 ml, the volumizing effect is just about 1 cc of this is Gouri injection. About the same previous movie, so I'll skip this. This is photo taken immediately after the Nibelang and Gouri treatment. Even though 10 syringes of Nibelang contained only 2.5 cc, the volume appears to be around 5 cc. This is because Nibelang instantly provides double the volume when it injected. You can see her face is shortened by the contour line volumizing. Dimple on temple, lower cheek, and chin are much improved. 1 month later, the volume effect is double than the immediate results. I'd like to show you the long-term follow-up result of long-lasting facial filler. This case, I inject 17 cc of filler on forehead, nose, under eyes, nasolabial fold, and chin. The side profile has transformed into a beautiful curve from the forehead to the nose and chin. After that, the client did not come for a long time, but finally came back after 9 years. First session, I injected 17 cc, but after 9 years, I was able to achieve the same volume with only 10 cc. Nearly 10 years have passed, yet she has maintained her enhanced appearance beautifully. This is conclusion. Gouri treatment is a simple injection, very simple injection, yet it delivers excellent rejuvenation and lifting effects for the face. When combining volumizing and facial contouring filler treatment with Gouri, a stronger lifting and rejuvenation effect can be achieved. In particular, using PCL-based filler, has excellent collagen synthesis capability, allows for more powerful and long-lasting results. Thank you for paying attention to me.
Thank you very much, doctor.